In this video, we are talking about 2-month-old body tension. So basically body tension in infants, newborn to 2 to 3 months old, and how that body tension can influence their ability to do the things that they need to do, like tolerate tummy time. We're also going to show you proactive parents at home how to check for body tension in your newborn infant and a couple of strategies of what you can do to help solve that tension. Hi, I'm Dr. Lauren Baker, a pediatric physical therapist, and on this channel, we help proactive parents learn tips and tricks to help their littles move better. Think of me as your pediatric physical therapy bestie, here to help you help your babies move with confidence and ease. In the video today, we are talking about body tension. And body tension in infants is something that does not get talked about very often, but can have a huge impact on how infants experience their daily life, how they move, how they tolerate tummy time, how they play. It can also set them up for things like a diagnosis of torticollis, flatness on one side of the head, preferences in body position. Oftentimes, parents aren't taught that there are things that they can do to check to see whether or not their infant's body is moving fluidly side to side, and that you really can screen this starting from them being newborns. In the video today, we're going to see a 2-week-old, but most parents will probably find this video at about the 2-month-old age. Let's be real, parents are barely keeping their heads above water for the first 2 months. Or if they do notice that their infant is struggling, typically it's with things like feeding, and they're seeing a lactation consultant, which if you are, I am so proud of you. I love lactation consultants. One thing that you may not be told if your infant is struggling with latching or feeding, or you just notice that, hey, they might just look a little bit uncomfortable in their body, is that oftentimes tension can be not just in the mouth, but it can be in the whole body. Now, flexibility in the body is really important, both for feeding as well as for tummy time. When babies are on their bellies, they need to have flexibility in the front of their body, all the way from their neck into their pelvis, so that they can activate that trunk, push through those elbows, and lift the front of their body. If you notice that your little is struggling with tummy time, I want to make sure that you know that there is a free tummy time checklist that I will link right up here, so that you can make sure that your little has all of the building blocks that they need to be able to tolerate tummy time. Now, if you are one of those proactive parents and you're like, give me all of the information, I wanna make sure that you know about my book, Tummy Time and Learning to Roll. This book is gonna have all of the information that you need to make sure that your little is set up for success so that they can master all 4 directions of rolling. It's gonna go through my 4 proactive play positions for littles to have the foundation that they need in order to get ready for rolling. So it does start newborn all the way through about 6 months. And then it's also gonna be perfect for parents if a little is struggling with tummy time or is struggling with rolling, to help them figure out exactly what might be blocking their little. And one of the things I'm really proud of is my philosophy that parents can do so much good and can be so proactive for their children if they're just given the information that they need. And one of the sections in this book is the kind of risk factors or things to look out for your child. And we've already talked about lactation and feeding can be a big part of that body tension piece. We know that the fascia or that underlying tissue runs all the way from your mouth all the way into your feet. And so what we can find is that tethered oral tissues or some of the tissue underneath the tongue or in the mouth can cause tension in the front of their body, pulling babies forward. Releases for tethered oral tissue or tongue ties are only indicated if there's also a functional impairment. And so in the book on page 229, there's a whole list of things to look out for. difficulty with feeding, nipples damage or pain with breastfeeding, baby appears uncomfortable during feeding, difficulty opening the mouth, clicking noises with feeding, like the tongue is popping off the nipple or lip is popping off the nipple, gulping or wet coughing sounds, sleeping with the mouth open. We really want babies to be able to, when they're sleeping, suction the tongue to the roof of the mouth. In order to do that, they have to be able to lift their tongue. If there's tissue below the tongue, then the tongue's not going to be able to suction to the roof of the mouth, and that's going to limit palate expansion, which then can lead to orthodontic issues, difficulty with breathing, things like that. If you are interested in grabbing the book, I will link it up here as well as in the pinned comment and the description. Now, I do want to recognize that tethered oral tissues and releases are a very personal decision for a family, and I would never indicate or pressure families to make one decision or the other. I do, however, really like to make sure families are given the most information so that they can make the decision right for their child and for their families. Babies need to move in multiple directions. Newborns to around 3 months, those babies are still gonna have a really flexed posture, and that's okay. Their hips don't really fully extend until they're closer to that 3-month range where they're really tolerating pushing through their body, activating their glutes, and lifting their head up to 90 degrees. Now, we do want to make sure that they have the mobility in their trunk to be able to go into the I'm a little teapot direction, as well as the rotational direction. So these two screens coming up are going to focus on those two directions. You're not going to be pushing on the infants. You're just basically going to be taking up the slack. Like if you were going to move a hose from one part of your yard to the other part of the yard, you're just going to kind of pull on the available range. But if anything shows you resistance or feels like, that hose is getting stuck, you're gonna stop and not push past that level of resistance. And you're just gonna see, hey, is my baby able to move in this direction equally to the right and to the left? Or are they able to move pretty far on the right, but not as far on the left, or vice versa? And then we'll give you a couple of strategies and ideas of things that you can do to help solve that if you do notice that one direction is tighter. The first direction we're going to do is the I'm a little teapot direction. So you're going to tuck their bum up and round their back, and then you're going to swing their pelvis over to the left to make a C shape in their back. You're only going as far as the baby will let you. You see here that he tenses up, so he kicks me out and I go back and then I try it again. And as I go to the left, fluid, I gotta get him to relax a little bit. He's pretty fluid going to his left, but when I go to the right, he tenses up a little bit. So you can see here, he kind of kicks me out, and then as I try to get him to relax, he tenses up right there at the end range. I wanna make sure that he is moving fluidly to the left and the right, that his knee is getting close to his elbow like it is on that left side, but you do sometimes have to monitor head position. So we want the head to be facing the top or the opposite side. So you can see there that going to the right was a lot easier that time. And so you might have to just do it a couple times to really check to see, is this equal side to side? You want to go nice and slow, and you want to make sure that the baby is equal side to side and that there's not some drastic differences. This is another example of a baby because I wanted to show you guys what it would look like if the baby struggled with the opposite direction. So this little struggles bringing her hip to her elbow on the left side, but does really well when I bring her pelvis to her elbow on her right side. If I wanted to treat this, I would use a total motion release technique. That's where this clip is from, so I will link that up here. But basically, you're gonna hold this position to the right for 2 to 5 minutes, followed up with 30 seconds to a minute of bouncing, and then a functional task. The next direction we're gonna do is rotation. So you still want them a little bit rounded. You're gonna bring their pelvis to one direction and try to bring their shoulder to the ground this direction, the right shoulder is closest to the ground, and then the next direction, the left shoulder is closest to the ground. You see me repositioning him there. I want to make sure his body is in a pretty straight line and that his head is upright as much as possible. You can see here as I bring his pelvis and his legs over to the right and his left shoulder elevates off the ground, that it is higher than, and we'll see that again, his left shoulder is higher off the ground than his right shoulder is. I'm going to show you it a couple of times. Sometimes it takes a little bit with these littles. So again, I'm going to rotate the pelvis to the right where the left shoulder is going towards the ground. I'm not pushing on his shoulder, I'm just picking up the slack. The next direction that we're going to go back to is the right shoulder on the ground. So it's pretty clear here that his right shoulder is significantly closer to the ground, and you can see me put my timer here. If I was gonna improve his mobility, I would hold this position for 2 to 5 minutes in the easy direction. So his right shoulder easily goes to the ground, and I'm gonna hold this for 2 to 5 minutes and follow it up with about 30 seconds to 1 minute of bouncing. This is a total motion release technique. I talk about it a lot on this channel. It's one of my favorite ways to help babies improve mobility. And if you're curious about that, all of these positions are listed in the book that will be linked up here as well as in the pinned comment. After about 1 to 2 minutes, if they have a low tolerance, or 2 to 5 minutes if they are nice and relaxed like this baby, you're gonna again follow it up with 30 seconds to a minute of bouncing to really lock that in, and then finish it with tummy time or another activity. When you are playing with your little on the floor, you can see it can become a whole family activity. Because I was filming, everyone wanted to be famous. And so I love my little friends who are just so excited to be around. And that's a wrap, friends. Thank you so much for taking time out of your busy schedule to watch this video to learn more about body tension in infants and baby flexibility so that your little has the best opportunity that they can to feel good in their body, as well as to have a really good, flexible yet strong foundation on which to progress to rolling. If you haven't yet, make sure you grab a copy of my book, Tummy Time and Learning to Roll, especially if your little is newborn to 6 months. It is gonna have everything you need, including 240 photos of different play positions and ways that you can interact with your little, as well as breaking down rolling belly to back and back to belly. If you have any additional questions, make sure you drop them in the comments below. And for those parents who really want a little bit more one-on-one time with a pediatric physical therapist to ask questions, make sure you check the pinned comment for a link where you can schedule a one-on-one online parent consultation with me, where we can make sure all of your questions are answered, help you figure out what next steps might be best for you and your little, as well as give you the education or resources you may be looking for that are specific to what's going on in your baby's season of life. If you are still curious about more ways that you can help your infant move well, I want to make sure you check out this video. It's one of my favorites for infants 0 to 3 months. It helps with their neck control as well as their trunk control. And it's a really great early exercise that will start laying the foundation for rolling.